Are you a thoughtful leader? Maybe you are. Maybe you think you are. Let's find out. I'm Mindy Gibbins-Klein. I'm author of The Thoughtful Leader and host of the Thoughtful Leader podcast. Thoughtful leadership is all about thought leadership that goes above and beyond. Thought leadership that is truly new and original, exciting, disruptive, maybe even groundbreaking. Because let's face it, we need to raise the bar. My guests and I are absolutely obsessed with finding truly original thought leadership, and I'm going to bring you so many exciting ideas and opportunities, things for you to think about, and chances for you to push your thinking that you'll be very glad you tuned in. So thanks so much for checking out Thoughtful Leadership and the Thoughtful Leader podcast. I look forward to connecting with you very, very soon. Welcome to the show. My guest today is the amazing thoughtful leader, David Maddams. You guys are going to love David. Hi, David.
Hi, Mindy.
So I was going to say Dr. David Maddams. You still are doctor, but why don't you tell the story of where you practiced and what's happened in the past few years?
Yeah, so I suppose if you look at the journey, it goes right back to sort of early days. Why do people become doctors in the first place? And then that makes it all the more difficult to give up at the end when you retire. So I think from a very early age, I probably decided I wanted to be a doctor, and I think people were telling me I should be a doctor. I think when you talk to a lot of doctors, there's been something that's happened in your life that makes you think, I think that would be a good thing to do. And certainly that happened to me. I did lose a parent in childhood, so that had a big impact. But actually, I was then propelled a few years later into an amazing step family who were very supportive, and they were always telling me, this is what you should do. So I didn't get along with that at first. I first applied to go to agricultural college because I have a great interest in plants, green spaces, that kind of thing. I'd done a psychological test at school that suggested maybe that would be a good thing for me. And then I put my form in to apply to university, and then I looked at people that were applying to be doctors, and I thought, I'm sure I can do that. So I recalled my form and I put in to become a doctor, and it's kind of gone on from there. I've been very fortunate with the way things have kind of dropped on my lap since then, with jobs and what have you. And funny enough, I ended up working for 32 years as a GP in my hometown, which was something that I never arranged, but I followed my wife's career, and we happened to move next to a doctor who was recruiting to my hometown when I was looking for a job. So I tried to escape from where in Hertfordshire, but I never managed. And it kind of went on from there. I didn't realize until I'd read your book just how thoughtful we'd been as a practice and how thoughtful I'd been as a GP. But we started off pretty early. We were a young practice. There've been lots of retirements all at once. And we started off trying to make this the best that we could. First of all, we made it into a teaching practice so that we could get young people coming in and learning how to be GPs. That took a lot of hard work, but we did that. We were one of the first in the area. And when I left, all the GPs in the surgery were trainers. We also went ahead with getting the Quality Practice Award from the Royal College and all kinds of things. So it was quite a journey. It was quite hard to leave. But if you read the book, you'll realize the huge pressures that GPs and practice nurses are coming under. And I got to 60 and thought, I think I'm done.
Yeah, well, you're done with that, but you're never done with the caring, the thoughtfulness, the just, your nature is still the same.
So I've gone on since then to become an approved NLP practitioner. And I've been applying to various things within the NHS, but I haven't been asked to do anything yet. But I would hope perhaps, with all this stress that's going on in the world at the moment and with the NHS that I could use that NLP skill to some good use.
Definitely. Well, everything is related. So, you're never wasting a skill. I'm very keen to ask you about the NHS. So the NHS, for our international listeners, is our health system here in the UK. And it is, I think it's a brilliant organization. I know there are countries who are pushing against socialized medicine or centralized, health organizations, but I have been very grateful for it. Why don't you chat with us a little bit about the NHS and how things have evolved? I mean, not since the 1940s when it started, but, what your thoughts are about that organization and the future of it.
Yeah, it's changed an awful lot, obviously, when you're in an organization for, I was a GP for 32 years, but I was actually a doctor for probably best part of 37 years. So you see a lot of change. And obviously, as you get older, you look back and you think, oh, wasn't that great the way we used to do things? But, you have to evolve. But I think one of the difficulties that people like me face at the moment is that relationship with patients has changed because you've become so busy. When I started out, especially as a junior doctor in the hospital, you could work 100 hours a week, but you were supported. You could get a hot meal whenever you wanted to. You had a doctor's mess you could go to and offload to colleagues. You often lived in, so you had that support wrapped around you all the time. And the same when I went into general practice, it was quite common that you would be on call for your practice, having worked the day and possibly working the next day. You would also work the night. So that could be very, very tiring. But actually, you had lots of free time in between and you could do things your way and you had more time with patients. It was quite a joy to go on a home visit, to see somebody at home, which increasingly you're hearing now, GPs are finding it really difficult to find the time. It takes 4 times as long to go and see somebody at home as seeing them in the practice. So there are lots of changes. And in my book, I was writing about the stress that was kind of building, and you could see it building. Lots of really good people had retired early before me, people that I knew because I was also a GP educator, and these tended to be people that were really, really good at their job. And I thought it was really, really sad that we were losing that expertise. And I think now with the pandemic, because that's kind of ranked things up, it's cranked it up more to be even more of a difficult situation. And I know because I've got family that are also doctors. So it is a very, very difficult time. And I think we do need some thoughtful leadership now to take this forward. Otherwise, we are going to lose a lot of people, and we need them.
So thank you for mentioning thoughtful leadership in the space of the NHS and healthcare. How specifically do you feel things could be more thoughtful, or people involved in the NHS and decision makers could be more thoughtful?
I think to start with, it's the thinking. I think certainly in the last 25 years, there was a big change in the NHS, and it became much more commercialized, I would say, for want of a better word. So it's all become very money, very budget focused. And I think sometimes we have to look at the outcomes that we wish to achieve and make sure we get those outcomes and not get so het up on the money all the time. I think also thoughtful leadership means looking after your staff. And I think quite often the thinking has been, oh, this is what we want to achieve, and possibly looking at it from a politician's point of view, it seems a really good idea. But actually, you've got to think of the people that are implementing that change, and do they have all the resources? Are there enough of them? Can they actually do it? Is it a reasonable thing at this time to ask people to be doing? So I think that's where I would pitch thoughtful leadership at the moment. I think certainly when I started out as a GP, you had much more flexibility. So if, say, a particular policy came down from government, you could kind of run with it and you can make it your own. But I think there's less of that now. We're supposed to be independent contractors, but it doesn't feel like that anymore. It feels you're always being told to do things. I think also think about the language. There's a lot of negative language in the press, but there is also negative language from the leaders at times. You get told frequently, oh, you're not referring enough people for cancer. Then you leave it a couple of weeks, then the headline will be, you're referring too many people, it's too costly. Not necessarily cancer people, but people generally. But it's kind of mixed messages. And I think that kind of needs sorting out, really. Because otherwise people get very despondent and they don't really know what they're meant to be doing. They don't know what's being valued. They don't feel so valued.
That is essential. No matter what industry you're in, is making sure your people feel valued or doing your best. I mean, you can't make people feel anything, but setting things up and keeping them in mind, being respectful and putting more thought into your interactions and relationships. So that, yeah, you're spot on, as we say. The interesting thing is, I have read that we don't have enough doctors. And then I've read that doctors can't find the positions. Is it they can't find the positions they want, or what's happening with, the number of doctors and nurses and healthcare in general? Because we need a certain number to cater for the number of people we have, right?
I think one of the issues is how you play around with numbers, isn't it? So I think there is a drive to try and get more doctors, but there's actually an awful lot leaving or going part-time, more people becoming what's called a portfolio career, where you do a bit of this and a bit of that. So the numbers may be there, but the hours of work aren't necessarily. I think women, particularly with a family, find it very, very hard at the moment. I mean, I was on a Zoom call last night speaking to so-called wise GPs. But there was a few gate crashers there, a few younger GPs, and it's really awful to hear, mums that are doctors, just trying to juggle all these things and looking and sounding so utterly exhausted. So, and as far as the training is concerned, I think the word is that, yes, there are more students coming through from medical school, but I think some people are finding that the specialist training, particularly, there's been a bit of a block this year. The people have done their foundation training, which we used to call sort of house jobs. Then when they look at what speciality they want to go into, there's a bit of a logjam at the moment. So again, it's people not thinking through, if we have these extra students, we need to create the jobs that they can go into so they can progress in their careers. So again, thoughtful leadership is required.
Yeah, and of course, the pandemic was completely unforecasted, unprecedented, unplanned. And, I feel that the health service has coped really well. Other people may feel differently, but I think everybody certainly respects the frontline workers and, has seen what challenges they've had. And, a disproportionate number of them fell to the virus. And, that's really, really sad. So I suppose in real terms, we've lost good people, trained doctors who took, 6 to 10 years to train and, need to be replaced. And that's putting it very crudely. So in addition to grieving for those people, and I'm sure you know of stories or you may know people, we have the practical aspect of, more people than ever needing help at the same time and fewer doctors. Is that an issue?
Yeah, I think it is. I think the big fear, particularly looking at hospital-based medicine, is how much longer can those guys go on, without a break, certainly with the frontline staff. And I think also the kind of mental effect of actually seeing so many people dying, it does become part of the job. But I think sometimes people forget. I know I've had comments, from people that have read my book saying, oh, come on, we all work long hours these days. We all do 11 or 12 hours a day. But actually, when you're doing one patient after another and you're dealing with life and death issues, that's an awful drain on a person. And, when that's every day, day in, day out. And I think this is what GPs are also finding. A lot of GPs, obviously, during the pandemic, went over to using, non-face-to-face ways of dealing with patients, either telephone or video. And that was obviously for safety of keeping infection transmission down. But I think that in itself is very, very draining, just going from patient to patient, having to work out, am I going to need to see that patient, or could they be COVID? Am I going to need to send them to special COVID service? All that kind of stuff is really difficult. And when you're doing it day in, day out, it does take its toll. So I don't think we've seen yet the effects of that. And that does worry me because, as I was saying in my book, 2 years ago, we were coming in at a low ebb. People were very overworked and tired and fatigued. And this was the worst thing that could have happened. In some ways, it could be the best thing if our leaders start listening, because things will get to a pitch that one hopes they will have to listen. So it could turn out to be good for working conditions in the future, but time will tell, I suppose. Yes,
thank you very much for sharing those thoughts. I want to end on a positive.
Yes.
I was just on another podcast, and we were talking about people who've lost their lives and people who've lost loved ones, and it's very difficult to say anything positive about that. But lessons learned, since that's a phrase that you mentioned, how can the average person help their healthcare provider? Let's keep it really broad. Are there things that the average person or patient sitting at home can do?
That's a difficult question because I think it's a massive problem. Obviously, people can self-care more where possible. I'm sure there's lots of people trying to do that already. So, I'm not going to suggest that people aren't trying their best. I think just possibly have more belief, as we used to, in our doctors and nurses, that they are really doing their best. Don't always believe what you read, because there's a lot of negativity out there at the moment. I think ultimately people probably are going to have to start writing to the leaders that can make a change. And, maybe when you see your GP or your practice nurse next time, ask them truly how things are. And don't accept, I'm fine, because that's normally what people say. But maybe if people start sharing more what really is going on, then maybe the best thing that patients can do is actually write to the leaders and say, look, we want something to happen.
Thank you so much for making people think, not making people think, but for offering those words that hopefully are having people think about their healthcare providers and their own situation, and just appreciate all of the good work and caring that goes in. It's not just about the Hippocratic Oath, it's people who really care, who've trained for a reason to look after others. So we appreciate you, we appreciate all doctors, all healthcare workers everywhere. Listeners, if you want to get to know David and look him up, all of his contact details and other details are in the show notes and his bio. Please do seek him out, read his book, and most importantly, get yourself into a place and a space where you can do something to help, because that's what David has done. So everybody helps in their own way and does their own job. But thank you very much to you, David, for being here today with us. We appreciate you, and we'll see you soon. I hope you've enjoyed this episode of The Thoughtful Leader, and I hope it's inspired you to be more thoughtful as a leader in your business. Please consider subscribing and leaving a review. An important question for you. Do you want to create a culture of thought leadership in your organization? My best-selling book, The Thoughtful Leader, is available now on Amazon and many other sites in paperback, ebook, and audiobook formats. Please visit www.mindygk.com for more great content. That's www.mindygk.com. Speak to you again soon.